In this next video, we will continue entering a new patient record. We will continue to the vital sign category. After you have entered the pre-hospital data element, you will continue to vital signs. Under vital signs, you will begin by selecting the vital sign date and time. To learn how to use the date and time function, please go to our date and time function video. The next element is signs of life. You will select from a drop-down menu from one of the following options if the patient had signs of life: no, unspecified, not available, or yes. Our next vital sign is heart rate. You will be able to type the numeric value of the patient's heart rate under this element. We will continue to arterial pressure, systolic. You will have to type in the systolic blood pressure of the patient. The next element is arterial pressure, diastolic. Here you will enter the diastolic pressure of the patient. We will continue to respiratory rate. You can type in the numeric value of the patient's respiratory rate per minute. Our next element is a respiratory rate qualifier. This is a drop-down menu where you will have to select from the following options. Was the patient under assisted respiratory rate or was he unassisted? Our next option is temperature. You will be able to add the temperature in Celsius degrees. Our next three elements correspond to the Glasgow Coma Scale. We will have a drop-down menu with the different points. This will be automatically calculated under GCS total. If for some reason you do not have the specific GCSs such as motor, verbal, or ocular, you can leave them under select and you will be able to type in GCS total manually. Once you have selected that, you can continue to GCS qualifier. Under GCS qualifier, you will have the option to select from a drop-down menu. Was the Glasgow Coma Scale affected due to obstruction to the patient's eye? Was the patient chemically sedated or paralyzed? Was the patient intubated? Or was the GCS valid, meaning that the patient was not sedated, not intubated, and did not have any obstruction to the eye? If there are more than one options for this element, you can select them. Under AVUP, you will be able to select from alert, voice, unresponsive, and pain. Please remember to always save your record once you have finished entering all the elements of the category. This concludes this video. Please continue to our next video.